Hey everyone, and welcome. We're about to tackle one of the toughest, most delicate conversations in all of medicine. And that is, what do you actually say to a patient with health anxiety? You know the situation, where the fear of being sick is causing way more suffering than any disease you can actually find. It's a really high-stakes conversation. So today, we're going to build a guide for getting it right.
So let me ask you this. Have you ever had that feeling after seeing a patient, you've done all the tests, you've said everything's fine, but you just have this sinking feeling that you've handed them a really blurry map? You've told them where to go, you're fine, but you haven't actually shown them how to get there.
And what happens when someone's trying to navigate with a blurry map? Well, they get this tiny, fleeting moment of relief, right? But deep down, they're still completely lost. So of course the anxiety creeps back in, the symptoms feel just as real as before, and pretty soon they're back in your office asking for a new map, more tests, another referral, just desperate for a clear path out of the woods. And this, right here, really lays it all out. The blurry map approach? That's all about vague reassurance and just ordering more tests. It gives that temporary relief, but ultimately the patient stays lost. What we're aiming for is the clear map. That means a real, functional explanation for their symptoms, a clear plan of action, and building lasting trust. It's the difference between just placating someone and truly guiding them.
Okay, so let's get into it. The first step to drawing that better map is choosing the right words. And you might be surprised to see that the language we use has a real, measurable, and honestly, a sometimes shocking impact on our patients. Just look at this number for a second. 93%. I mean, what could that possibly stand for in a doctor's office? It just seems impossibly high, doesn't it? But believe me, it is very, very real.
So here's the reveal. That 93%, that's the number of patients who felt judged or totally dismissed when a doctor told them their symptoms were all in the mind. This actually comes from this fascinating study that came up with a metric called the number needed to offend.
Wow, just look at this table. It's so telling. That phrase, symptoms all in the mind, has a number needed to offend of 2. That means you only have to say it to 2 patients for one of them to feel totally alienated. Now compare that to the term functional weakness. It has an offense score of just 12%. You'd have to say it to 9 patients before one felt offended. The difference is absolutely staggering. This isn't just about semantics, The words we choose can either build the foundation of trust or they can blow it up completely.
So, knowing what not to say is one thing, but how do we actually build that clear map? Let's walk through a super practical 4-step guide for having a much more effective and, frankly, more compassionate conversation. Okay, here they are, the 4 key landmarks on our new map. First, we're going to validate and connect. Second, we provide a solid, functional explanation. Third, we shift the goal away from this endless search for a cure. And finally, we build a care plan together. Step 1 always starts right here. Before you explain a single thing, you have to validate their reality. Using a phrase like this acknowledges their genuine distress. You're not agreeing that they have a scary disease, but you are saying, loud and clear, I see you, I see your suffering, and I believe that it's real. And here's a brilliant little tool for making that connection. It's called the one-down position. Now, this isn't about being weak or subservient, not at all. It's about being humble. It's about saying something like, medicine is really good at ruling out the big, scary stuff, but we're not always perfect at explaining every single symptom. That simple admission just melts away the all-knowing doctor persona and invites the patient into a real partnership. Okay, on to step 2, the explanation. This is our chance to replace that big, scary unknown with a model that makes sense and isn't stigmatizing. And honestly, the smoke alarm analogy is fantastic for this. You can explain that their body's alarm system, their nervous system, is working perfectly fine, but the sensitivity dial is just turned way, way up. It's treating a little bit of smoke like it's a 5-alarm fire.
And this quote right here helps you take that explanation even deeper. It's all about symptom amplification. You're making it crystal clear that what they're feeling is 100% real. It is not imagined. But that anxiety is acting like a volume knob, cranking up the intensity of totally normal body sensations.
Now, step 3 is a really critical pivot in the conversation. We have to explicitly shift the goalposts. The mission is no longer this impossible quest to make every weird sensation disappear forever. The new, achievable goal is to improve their quality of life, to help them function well and feel good, even if some of those sensations pop up from time to time.
And finally, step 4 is all about putting a plan together. And when it comes to suggesting something like therapy or CBT, the framing is just everything. Instead of it sounding like a treatment for a mental illness, you can present it as a proactive, empowering choice, like specialized training to learn how to turn down the sensitivity on that overactive smoke alarm. So now we have a guide for the journey, but we also need some clear rules of the road, right? Let's talk about 3 big traps we have to avoid if we want to keep the patient on the map with us and moving forward.
Here are the big 3. Number 1, as we've already seen, avoid dismissive language like the plague. Number 2, resist the urge to just give simple, repetitive reassurance. And number 3, once you've ruled out serious illness, you have to stop ordering more and more unnecessary tests. Each one of these things can actually sabotage the very trust you're working so hard to build.
This slide just nails it. It shows you exactly how to reframe reassurance. Look at the left. You're fine, the tests are normal, it's a dead end. It shuts down the conversation. But look at the right. The effective approach says, hey, the normal tests are great news, but I get that the relief doesn't stick around. So let's talk about why the worry keeps coming back. See, it opens a door to the real problem instead of closing it.
All right, let's bring this all home. Let's look at what this new approach, this clear map, actually gives our patient, because it's about so much more than just giving them information. It's about rebuilding a fundamental sense of trust.
So, remember where we started with this idea of a blurry map, a way of communicating that leaves patients feeling confused, invalidated, and just trapped in this awful loop of fear and searching for answers that never seem to come.
And this is the solution we're working towards. A clear, well-labeled map. It orients them, you are here, you're safe, but you're also anxious. It defines their vehicle. You've got an over-alert nervous system. It clarifies the destination. We're aiming for a better quality of life. And it lays out the route. Here's our collaborative plan with some specialized support. It gives them power. It gives them clarity.
And that really brings us to the most important point of this entire conversation. Our job description in these moments completely changes. We have to stop being disease detectives, endlessly trying to prove a negative. Instead, we become trust builders. Our job is to help the patient rebuild trust in their own body, in us, and in their own ability to live a full life.
And that really leaves us with this one vital question to take back to our own work. How can we, in every single one of these conversations, make that conscious shift? How can we transform what feels like a desperate hunt for a hidden disease into a collaborative journey toward rebuilding trust? Thanks so much for joining me today.